You're listening to Business Success in a Virtual World podcast. If you are a leader navigating these new immersive technologies, this is your definitive resource to understand the innovative power of XR, VR, and AR. I'm Tim Beharon, Chairman of Creative Strategies, and I'm joined by Barton Goldenberg, President of ISM Guide. In each episode, we navigate through new products, effective strategies, and highlight actual business case studies implementing extended reality into business processes. Our resource website now boasts over 300 case studies, 300 articles, and 100 videos presenting successful examples of businesses using these technologies in field service, training, digital twins, customer service, in medical and manufacturing, and so much more. Check out the website at ismguide.com. Now, on to the next episode. This week's podcast is a fascinating one. There was an article recently written in Time Magazine that talked about a surgeon using the Apple Vision Pro for surgery. And he gave a good explanation of why it was so important. So we're going to share with you a little bit about that article. And then we're so pleased again to have Dr. Harvey Castro join us, who has 20 plus years as an emergency room physician and is a great authority on the role of especially technology and now VR and AR being used in the medical profession. So Barton, over to you.
Thanks, Tim. Welcome to everybody. 24 years ago, a surgeon from the Center for Future of Surgery at UC San Diego performs a robotically assisted gastric bypass surgery, which was a major breakthrough. This doctor now has taken 20 years later, and within the University of California, San Diego, they perform more than 20 minimum evasion operations, not wearing what Dr. Horgan wore 20 years ago, but now the Apple Vision Pro, which, as you know, is a mixed reality headset. And what Dr. Horgan has said is this type of technology has improved his effectiveness while lowering his risk of injury, and it could have an enormous impact on hospitals across the country, especially those without means to afford specialty equipment. Now, here's the trick. When, let's just say, a doctor does laparoscopic surgery, they send a little tiny camera through a small incision in a patient's body. Then the camera's view is projected onto a monitor. And the challenge is the doctors have to, on the one hand, operate on the patient, but on the other hand, look at the monitor, the screen, which is a tricky feat of hand-eye coordination while processing all the other variables in this pressurized OR environment. That's why surgeons report experiencing discomfort while performing these minimal access surgeries. And in fact, about a fifth, that's 20% of the surgeons polled in a 2020 study said that they would consider retiring early because their pain was so frequent and uncomfortable having to move from the operation to the screen, back to the operation to the screen. And the point is, a good mixed reality headset like Apple Pro might allow the surgeon to keep a focus on the actual operation and have information fed into their actual lens that they're looking through rather than having to, look away from the operation at other screens. Another person from the University of San Diego, gentleman is Christopher Longhurst. He said, I thought something was very interesting. He said, listen, we think maybe $3,500, which is the current price of the current Apple Vision Pro, is expensive. But if you compare that to an average cost of $20,000 to $30,000 for a monitor in the emergency room, the Apple Vision Pro actually becomes rather cost effective. And there's also a test going on now using Apple Vision Pro to create 3D radiology imaging. And all of this allows this gentleman, this Chief Clinical and Innovation Officer at University of California, San Diego Health, we believe that Apple Vision Pro is going to be the standard of care for the next years to come in operating rooms all over the world. And I want to close the introduction to the article with one other gentleman, the gentleman who heads up general surgery at Cedars-Sinai Medical Center in Los Angeles. His name is Michael Birch. And he said that Apple Vision Pro is especially useful because of its adaptability. If everything we wanted to use in augmented reality is proprietarily attached to a different device, and would have 10 headsets and 15 different monitors. He said, but with this one, you can use it with anything that has a video feed, so you have one monitor. I just think it's a fascinating concept. And Dr. Harvey, I wanted to open this up with you. I just wanted to get your overall feelings of this Apple Vision Pro, this article, some of these fairly outrageous statements about becoming the standards, and where do you come from in all of this? What's your take?
You see, my take on all of this, big picture, I truly think this is a true game changer on so many levels. From 10,000 feet high, if I'm a surgeon and I'm having to look to the right, to the left, and keep my hands sterile and look down, there's all these things going on. But if I could be in control of all the data and it could move with me, and if I'm focused on a certain area, obviously it's the surgical area, and I need information, I don't have to ask the nurse, hey, open up that screen, take a look, what's going on? Can you scroll for me now? With my eyes, I'm able to do that. That is just so huge. And especially as an ER doctors, when seconds count, I need that information now. I don't have that luxury. So to be able to see all the parameters of the patient, that's another thing the article didn't talk about, but imagine I'm taking care of you. And before the anesthesiologist or anyone starts saying, hey, his blood pressure is dropping, hey, this is going on, I'm already seeing the trends myself. It's already there in my vision. I mean, what an amazing thing. Before, I call it, let's be instead of being reactive, I'm being proactive. So just from the start, just to start us out.
Yeah, that's fantastic. I think you've confirmed what the article said, and that is the need for a surgeon today to keep his or her eyes on the operation using, in this case, a Apple Vision Pro screen. It can show the CT scan, the endoscopy, the heart monitor, all within that headset, versus, as you've already alluded to, turning around, stopping the operation to see various data on monitors in the operating room. And as you said, seconds count and focus counts, and so that's great. Now, I want to be a little provocative here. I want to ask you, what are the potential limitations of an Apple Vision Pro in the operating room? And we know there's such things as like battery life or weight. And how might Apple address these to better suit the surgical environment?
I agree. The battery life could be an issue. I know I spoke to a neurosurgeon the day after the Apple Vision Pro came out, and he literally was doing spinal cord surgery. And I'm like, how did you do it for 8 hours? He said, oh, it was pretty simple. I had a nurse swap out my battery, and I had an extension battery to my battery, so I kept giving charge. So that did not become an issue. The other thing that I thought was, well, is it distracting to you? Because playing devil's advocate, if you have all these things in front of you, that's a new workflow. When I got trained, that wasn't part of it. So now I'm having to train my brain into seeing this other virtual reality and integrating it into my workflow. So that could be a limit for some individuals. The other thing, I don't think I know you're asking for limitations. I didn't mention this. As we get older, our vision isn't the best as it should be. And one advantage of having the Apple Vision Pro is if I'm looking at a surgical field, you all have this mental vision with the doctors with the little magnifying glass. Well, imagine having this on, but now virtually I can expand that that field of view. That is huge to be
Yeah.
able to do that.
Yeah.
It may do even a better job than the magnifying glasses that you have on.
So there's lots of technologies that find their way into medicine and into the operating room. And I'm always questioning, given that medicine really leverages sound data, how many operations, how do you make Apple Vision Pro the standard of care as we move forward? Is it, 20 surgeries in invasive surgery it's some, but it's not a lot. How do we grow this? I mean, because everything has to be done on this medical data, that it's sound, that we're getting good input and so forth. How do you move from today to, for example, these type of AR glasses, Apple Vision Pro, become a real standard for the future, particularly as you might have alluded to as well, in areas that may not be able to spend $20,000 or $30,000 to have these monitors, these expensive monitors, and really need to use a lower cost Apple Vision Pro. So I'm just curious, how do we go from today's situation to what could be a standard of care in a more universal way tomorrow?
Yeah, that's a tough one. Obviously, if I'm a neurosurgeon, I have the budget to be able to expense that. But if we're in a different department, say an ER, they usually say the ER loses money for the hospital, so we don't get the fancy toys. Given that example, how do we create that if that ends up being the standard of care? The way I see it is one of two ways. I either see the government stepping in and saying, look, this is a standard of care. This is how we need it. We're going to subsidize a certain amount to make sure that these instruments are there for everyone, including areas that cannot afford these tools. The second is the entrepreneurs out there that have the amount of money to say, you know what, I want to donate to this cause, and I want to make sure that every part of the world has equal access to the same technology. And those would be ways, but it's really tough because these are so expensive. Give you a real example. I was consulting out in Africa, and they were like, Harvey, we want to do this particular idea using the meta glasses. And I was explaining, and then and I was telling them. But one of the issues that came up, he said, Harvey, if we have these laying around, the patients are going to start stealing these, and these will become a commodity out there. And I was like, wow, hadn't even thought of that. And so, even though we want to supply these tools in these underdeveloped areas or developing areas or regions that don't have equal access, then that was an area that we need to also address, that, hey, these things may be stolen.
You know, you've also, though, just raised a very interesting point. And I've come across this a couple of other times, but it seems a bit of a strong business case. If you go to Medicare and you said the average surgery takes this long, it costs this much money, and let's just say it's 10 or 100, and you say if you subsidize these glasses, we could bring the operation down to 50. It's going to cost you 10 for the glasses. They're still getting an operation completed at 60 instead of 100, so Medicare saves money. So, you know, it's not always the case that the government's going to step in and subsidize a for-profit or even a not-for-profit hospital. But if the case is that strong, and I think it is, then that could be a very interesting way to get more headsets into the surgical operating theaters. It's also important, I want to just switch on purpose, at medical school. And that's where, you know, when the younger students and medical students, you know, they're more open to technology and using the technology. What's the role of universities today, Harvey, in prompting that use of AR, VR, such as the Apple Vision Pro?
Well, two things come to mind. My favorite phrase in med school is see one, do one, teach one. So back in the day, I'd have to see it. Imagine something complicated like a surgery case. I had to see it. Then literally they would put me into the OR and say, okay, Harvey, now you're going to do it. And I'm like, whoa, I've only seen it once. And then after I've done it, they're like, all right, look to your right. You need to teach that person. Now with VR, I can do all of that with VR, not harm the patient. Now I can practice over 100 times. The other thing I want to say is, when I was a med student, I was that guy that the older doctors were like, Harvey, come over here. What is this Palm Pilot that you're holding in this device? Explain how this thing works. And I would explain in the future and whatnot. And so with that example, we need the medical education to educate the older doctors, to push, to innovate. It's the young buck coming in, being the preceptorship that we all heard about back in the day when I became a doctor. You know, like this was like 200 years ago. The way you would learn medicine is you would have an elder teaching you. Well, now it's kind of going the other way in the sense that the elder is teaching you the ways of medicine, the art of medicine, but then the future budding medical students are teaching them the technology, and they're meeting in the middle and creating something. And so with that example, I think that is the way we should be doing medicine. We need to, from the ground up, use, my favorite phrase is, I'll change it up for this conversation, and it's going to be technology plus human will beat the best technology or the best human. It's both together. And so with that statement, we need to integrate that in the med schools, teach our students, and move that wave so that it can continue to move forward.
Yeah, it's great. I'm going to ask another question, but I just want to remind our viewers, there's a couple of podcast episodes that address this issue head on, and one of them is the Mayo Clinic, which is a podcast episode, and it talks about how when you enter Mayo Clinic as a resident or whatever it may be, you are obliged to learn how to use VR and AR before you can touch any of the labs or any of the equipment. It's just the way they train their people. And another podcast episode I want to refer you to is VR in surgery, I think it's called. We did that maybe 6 months ago, and it picks up some of this, but we're really focused on Apple Vision Pro. Okay, Harvey, let me ask a question. In addition to surgery, Have you thought about any other areas in medicine where you see Apple Vision Pro that might be valuable in helping out?
You know, I'm really passionate about patient education. I think, imagine you are my patient and I'm educating you, but after a while, my voice is monotonous. I'm not maybe as animated, but if I could put this on you and pair this to, let's just say, your CAT scan. And now we can walk through your CAT scan. You're seeing it. I can be like, look, you see that nodule right here? Hey, can you see this? This is why I want you to take your medicine. And I'm educating you. But now it's like 3D. It's kind of like being in Hollywood. I'm giving you a show, but you're going through and you come out of that session and be like, wow, I know what he's telling me now. Oh my gosh, this pill that I haven't been taking, I need to take it. And so I think those application is huge. The other is, um, I work in an international airport area, close to an international airport, and I get people from all over the world. Being able to put this on to a patient that speaks another language and speak their language, and then now I can educate them because I hate going through a third party interpreter. I don't know how good that person is, but I know if that language interpretation using the VR is excellent, and I'm showing them graphics and I'm showing them more, I know I'm educating. So that's the second or first still. Then the other, I truly think there's a world here for radiologists. You know, we see the world in one dimension, but to be able to put this on and see a 3D dimension, is that little nodule, again, I'll use the same example, is that little nodule small? But if I can see it in 3D and get a better resolution, now I can really get a better feel. And yes, I can look at a number and saying, yeah, this is the circumference, the surface area, which should be about this. But if I can see it, puts me at another level. So I think that's the other. Then I've seen a lot of interesting apps out there that are using this for mental health. And so imagine you are stressed out and being able to put this on and then put you at your particular favorite place. Like my favorite place is going to the ocean. I love the ocean, the beach. So if I could put this on and be in the ocean in 10 minutes, man, I'm in heaven. And so if I'm depressed and and it's raining and it's snowing and maybe there's 6 months of winter here, I'm making it up. If I could put this on and feel like I'm getting sun and I'm hearing nature and I'm hearing the breeze, man, how much mental health improvement can I not improve from? And if I can pair that with AI and really speak to me, man, we're really helping people.
This is wonderful. I just want to repeat kind of what you said for our audience. Um, I'm on the East Coast. I went to University of Pennsylvania, and one of the doctors in the oncology department, it's a buddy of mine, he uses the glasses for the children that have cancer. And it helps the kids, first of all, as you've already alluded to, calm down. They watch various, cartoons or whatever they take their fancy. But as he gets to a slightly older patient, he uses it, as you've already alluded to, for patient education to explain what exactly they have and how he's going to come in and make his intervention. And it puts the patient at ease. And so you've alluded to that. I also very much appreciated the multilingual aspect. And for folks that may not know this, it's just a push of a button. And you can go through 50 languages on an Apple Vision Pro. This is a library, a language library. And so, you can choose your language. And that's, just think about that. And then, okay, so that's just what you said. Let me come to something that was mentioned in the article, Harvey, and I'd like your take on this. So from a public health perspective, what role might immersive technology like Apple Vision Pro play in underserviced areas with limited access to advanced medical expertise?
Yeah, this is a good one. Going back to my personal story, I was a medical school student at UTMB, it's basically in Texas, and we would take care of all of Texas prisoners. And obviously, that's a huge risk if that prisoner were moving them from prison A all the way to Galveston. That was really risky on many levels. And one of the reasons that they actually started pushing was telemedicine so that we could keep those patients in the prison and not have to have that risk for society or for, people guarding them. And so imagine that same bridging the gap is what we're talking about here. Bridging where I can get a consultation, not just from UTMB and my med school, but literally anywhere in the world. And now that patient and that physician can literally feel like they're in the same room, seeing each other, talking to each other. That could help equalize this, create that bridge that we're talking about, make that playing field equal. Obviously, the limitations is obviously the culture and the cost. The culture in that, some people are like, whoa, 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 I'm not wearing those things. I don't like it. And that's some barriers we have to go overcome. Obviously, the cost, yes, it's expensive, but I'm excited to see what the future will hold. I really think the future will be these glasses. This will be condensed to just simple glasses. And I really think that's what we'll be.
Well, let me just take this opportunity to ask Tim, technologist out of Silicon Valley and dear friend of Apple for decades. Harvey made the observation that perhaps they'll come down in price or perhaps they'll come down in size. Tim, what's your read on all of that?
Well, there's no question that Apple will do another version, and at a lower price. How low, we don't know. But you understand that when Apple actually introduced the Vision Pro, even at that price point, they were aware of that this would not be, a mass market product. And their true focus, I think, ultimately is more on the role of smart glasses and AR. But at the same time, when you talk to Tim Cook, their CEO, he's very clear that this ultimate vision of bringing people into an immersive world is really big part of Apple's long-term vision. So these kinds of stories, whether it's in medical or mental health, etc., they're actually helping Apple bolster their own internal business case to not only keep the Vision Pro going, but not only bring it down in price, but to make it even better. I think what the article points out that I think is so significant, twofold. One is this is replacing that $20,000 monitor that he had to, keep going up and looking and down and now he said all of that was there. The other thing that Dr. Castro mentioned is that the ability to have all of that data right there is a really big deal. And you're saving time, you're more efficient, and you're taking advantage of the technology in a much more focused way. So, from Apple's standpoint, the pricing issue, and again, in this particular medical case, as the article pointed out, this is replacing the $20,000 monitor. And at $3,500, they could do 3 or 4 of them. So not only the doctor has it, but his assistants have it as well.
So thank you, Tim. Always a pleasure to listen to your insights. I want to take what you said and I want to actually go back to Dr. Harvey with a related question. So Tim's talked about the ability for Apple headquarters and the executive team to continue to fund the Apple Vision Pro because of its strong business case. You've mentioned it in surgery, you've mentioned it in other cases, patient education, multilingual, 3D radiology, mental health, etc. I mentioned that the article talked about the ability for Apple Vision Pro to create 3D radiology imaging. And I want to go back to you now and ask you this question. What future advancements or integrations, such as AI diagnostics or remote coaching, or some of these new apps that we just talked about, how could that amplify the effectiveness of Vision Pro, Apple Vision Pro in healthcare?
Yeah, that's huge. My favorite phrase for the year is going to be, we don't know what we don't know. And having the Apple Vision Pro literally let us see what we don't know and understand is huge. As a doctor, I'm a stubborn patient and I don't like doctors, ironically. But if I have this and I don't feel threatened and I can have it speak to me and show me what I don't know, then I'm more likely to act. And so how does this pair? They have a great ecosystem. I have no shares in Apple, but I want to say I'm going to promote them here by saying having my wearable speak to my Apple Vision Pro and my parameters. Maybe I didn't get too much sleep last night and I'm trying to lose some weight. And then the Apple Vision Pro is able to give me a notification, be like, hey, tonight you need to go to bed a little earlier because you're not doing well. And if this is your goal, and then pairing this with dashboards with the healthcare system so that your doctor knows these parameters that you, let's use the same example, that you didn't sleep and that maybe you're eating, and let's say you have congestive heart failure and you're eating too many chips and too much salt is in your body and you're drinking too much water, or stuff like that, and now your weight's going up because the wearable is saying it to the Apple Vision Pro. But now as you're working and I'm doing a podcast with you or something, and then the Apple Vision Pro says, hey, if you're not careful, you're about to go to the hospital because you're about to go into congestive heart failure. You may need to cut down on those chips. And your doctor just sent the message and he said, up your medication to up your water pill. These are ways that we can be proactive instead of reactive.
Yeah, and you've mentioned, I mean, this is so fascinating, but you've mentioned also as we do more and more interventions with these types of glasses, we get more and more data. The data becomes, gets put into some sort of a server that can be inferenced using AI technology, which only delivers back even better recommendation, observations, images. So it's really, the future looks, it's very exciting for me. I'll just put it like that. Okay, so a question to you now is, do you think that VR and AR technologies like the Apple Vision Pro will become more widely adopted in medical education before becoming common in clinical practice? Will we grow into this through medical school, or will the surgeons of today, the forward-thinking surgeons, say, I don't care what my age and how long I've been away from medical school, this is this is something I need to learn right now?
Great question. And apologize for the background noise. It'll stop. Great question. Big picture is this. I think it'll come from both angles. I think unfortunately, if that medical department has a lot of money, they'll be able to fund it and that'll be easier to get it. I do see physicians, and I've talked to them saying, you know what, I want one of these for work. I don't care. I will buy it myself. I'm going to self-fund this. On the medical aspect, give you a real example. Cadavers are expensive. Cadavers take a lot of time and resources. I'm seeing a lot of medical schools going into virtual cadavers so that you can practice and go through it. And now you don't have that extra expense. And then there's a lot of ethics behind that as well. And now you're just practicing 100%. I know that when I was in med school, they had hours specifically. And if it was 2 a.m, I wanted to go to the anatomy lab, I couldn't. But if I had an Apple Vision Pro, it's 2 a.m, I want to practice some more. Now I can go all at it all night if I want.
Okay, so Dr. Harvey Castro has painted a very clear vision today and for what could be an emerging future of how we're going to use VR and AR increasingly in the field of medicine. I don't think for our listeners that this is a debatable topic. This will happen. The matter is how quickly, how many different types of medical applications or patient applications. So, my suggestion is if you ever have to have a surgery or you go to your doctor, one of the questions you should be asking is, do you use VR or AR in the surgical approach? I know I do it all the time now, just because I'm curious. Dr. Castro, any closing comments? And Tim, any closing comments? And otherwise, I think we're going to bring our podcast episode to an end. But Harvey, I'll give you the last word on this one, and then Tim.
Yeah, I'm going to say embrace technology. Let's take care of our health. The more we can prevent these things, we want to make sure we preserve our body so we can have the best longevity, but we want to have the best quality of our life. So I'm going to leave you with that. Use these tools, use these technologies for improving your health.
Okay. Tim?
Dr. Castro, thank you again so much for joining us. This is a fascinating podcast and topic because there is no question in my mind that the VR and AR technology is going to be part of the medical learning process and, in this case, the operational process. And that's important. One last thing, though, that I think Dr. Castro mentioned that I want to really emphasize, using it for patient education. I can't emphasize how I think that is so important. I remember when I had my bypass surgery, I went into it blank. I had no idea what they were going to do. And the doctors were very skimpy on telling me what was going to happen other than, by the way, we're going to cut you open and do this. If I would have been in a scenario where I could have seen, not necessarily the operation, that would have maybe grossed me out, but if I could have seen how they prepared, and they were ready. And I would have been probably a lot less concerned about going into that operation. And Dr. Castro, thank you for joining us, Barton, for all of those great questions. And for all of the listeners, we look forward to being with you in our next podcast. Thanks for listening to Business Success in a Virtual World. Barton and I have helped global companies successfully develop and implement strategies to utilize these new technologies. For more information or to contact us, please visit ismguide.com and select Metaverse Resource Center. Be sure to subscribe to this podcast on your preferred platform.